Would you like to talk? If you'd like to get something off your chest, please come in. A son? Oh, I didn't know. So how old is he? Let's start with something easy. Okay. What do you mean to say that you may find it? Let's just say it was someone I think we'll be able to expect them to act. So you reckon? Maybe. Or perhaps I'm just seeing it at the same time. Okay. Wouldn't he recognize you? There was conflict. I'm not sure he's ready to hear something in him. So he's such an army to you back. Maybe he's watching this video. Okay. For sign that all is. No, he's not the one who needs to be. I think he will still be very angry. Pain between parent and child is the most natural thing of all. I think he might be here to try to kill me. Right, that's not. I'll let him go. Spend my entire life since trying to fix it, and now he's finally here. I just don't know what to do. Be honest.
Hi, everyone. Get started in just a minute. Thank you for joining us. As you log on, go ahead and make sure you're muted. That would be really helpful. Thank you. We'll get started shortly. Well, welcome everyone. We'll have a rolling start here. Tonight we have a very special event that is being conducted live with our community as well. We have 5 wonderful health professionals joining us, 5 fabulous women. I'm grateful to all of them for reading The Plague and coming on board with their insights. We've had some really wonderful discussions, and it just goes to show that this novel is so roomy, it's so capacious, that it invites so many different readings depending on, you know, who you are. And so our health professionals have some really terrific insights to share. And I'll just start with a quick anecdote on behalf of Dr. Ramsdale. I'm going to focus on this just for a minute. We were talking on Friday about the novel, and she said she is an exercise and wellness specialist, and she said, I just thought it was so great in this scene with Taru and Rio, how they decided to go for this swim together in the middle of a pandemic. They were really taking good care of themselves by getting some exercise, and I thought, oh, this is lovely. I never even considered that. So, thank you, Dr. Ramsdale. And you'll find out, folks, that our health panelists have a lot of wonderful insights into the novel to offer. I'll just go ahead and say that in our breakout sessions, we'll go ahead and take care of class business. So stay tuned for that. The students in the class, if you don't mind, will forego the business announcements in light of our panel tonight. So we have several community members joining us. We have Zach Ziegler, the College of Arts and Letters program events coordinator, joining us. He has hooked us up to to Facebook Live. So our class is going live tonight for the benefit of the community. So this is a really tremendous opportunity, and I just can't thank you all enough. The health professionals, my fellow teachers, Dr. Walker, Dr. Rui, and Zach, and everyone else. So this has been wonderful. So I'm going to introduce the panel, and then I'm going to quickly summarize some of the things that we've been talking about, some of the things that they've said that's really interesting. And then I'm going to turn it over to them to make some opening statements and to specifically talk about scenes in the novel or ideas or themes in the novel that have really touched them. And I think that, you know, they're pretty fortunate too, because they have a captive audience of students who have studied the novel and who have had the benefit of talking about the novel before. But I think you students and community members will find that there's so much yet to talk about. One of the things that came up in our chat in preparation for this is all the things that are missing from the novel. And we have talked about this in the past. There's a paucity of women and female characters in the novel. There's a disappearance of the colonial subject in the novel. This is a Muslim country, and yet we don't have the call to prayer. We don't have the mosque. We don't have the imam. We know that this is problematic. But I would like to suggest to us all that we can learn so much from the novel, not just by what is there, but by attending to the silences as well. So I think that that is something important going forward. And I see that our dean, Chris Boyer, the College of Arts and Letters dean, has joined us. And I'm wondering if he would like to say a word of welcome, if he is available. Yes?
Yes.
Thank you, Chris. And thank you again for the College of Arts and Letters sponsorship of this interdisciplinary evening around Camus' novel, The Plague.
Well, I want to thank you all for coming. And I would like to just point out that these kinds of combinations between the humanities, the arts, and the sciences are absolutely, you know, I think just fundamental. We all know that to really understand the world that we live in, which we think might get more normal in the future, but one always wonders. It's going to require all of our thoughts. It's going to require all of our understandings. It's going to require all of our approaches. And so this, to me, actually epitomizes the best of the sciences, the best of the health sciences, and the best of the arts and humanities. And let me also just take a moment to thank Julie and Joya for putting so much work into this. You might not know, and I will be very brief, but you all might not be aware that this started out as sort of an idea for a book club. We would do a little reading, but in fact, it has turned into this incredibly complex. It's got a course component. Joya is doing oral histories in the community. It's got this going on, and so it really just has blossomed under their leadership. And I just want to thank them for the incredible energy and creativity they've brought to this project, and to thank you all for being here.
Thank you, Dean Boyer. I appreciate your words. Thank you so much. This was a team effort, certainly. The idea is only one thing, but a lot of my colleagues came together to make this all possible, including Dr. Rui, Dr. Walker, Dr. Peering, Dr. Krondorfer, who's joining us tonight. And one other event that we have to look forward to is in late October. In fact, Dr. Krondorfer and I will be leading an interfaith discussion on the plague, as roomy as it is. So we look forward to that as well. And of course, next week, as you know, we will be doing a storytelling workshop with several members of our community, talking about how they use stories in their own lives and work. So without further ado, let me introduce our panelists. And if you Zoombox people out there want to give us a wave to let us know you're here, I'll start with Dr. Samantha Sabo. She is an associate professor of public health and a senior researcher with the Center for Health Equity Research. Since March of 2020, she has been partnering with counties and tribes to address COVID disparities experienced by diverse communities of Arizona. And you can bet that Sam has expressed an interest in the colonial situation and the sort of disparities that might be existing, in the world of the novel. Next, Dr. Sandy Smith has been a physician for the last 25 years, 18 of which have been in Flagstaff. She has worked at NAU Campus Health since 2006, and she is currently the director of Campus Health. So we're really glad to have her here. And she has noted in particular the difficult conversations she has every day with patients who have tested positive for COVID and where to go from there. I'd like to also welcome Dr. Ann Newland. She is a physician and CEO of North Country Healthcare. She was a medical officer in Kayenta, Arizona for 8 years. And Kayenta, as some of you know, was the epicenter of the COVID-19 outbreak on the Navajo Nation in May of 2020. Dr. Newland, in fact, majored in German and political science, and she has a great interest in world literature. So when we reached out to her at the very last minute to read the book and join us, she said, absolutely, I've started it already. So thank you, Dr. Newland, for joining us. Mare Schumacher is an epidemiologist and a consultant for her own company, Mare Insights. She has been a public health professional for more than 25 years and an epidemiologist for 20. She has worked with county health departments and tribal communities on foodborne illness, influenza, and zoonotic disease outbreaks, as well as on less glamorous activities such as the analysis of risk behavior and disease data. So we're really, really happy Mare is here to join us. She is busy crunching data every day for a variety of counties and for the Tohono O'odham Nation as well. And then finally, Dr. Linda Ransdale. She's a professor in the College of Health and Human Services. Her specialty, as I indicated before, is health and wellness education. She has significant experience as an academic administrator at Boise State, Montana State, ASU, and as the former dean of NAU's College of Health and Human Services. She has served 2 terms as president of the National Association for Girls and Women in Sport. So we have a wonderful panel with a variety of things to say about the novel. I want to thank them again for their close reading of the novel. And I want to thank you all for being here to engage the novel. Again, I'm so excited. So I'm just going to summarize briefly some of the things that came up in our preparatory conversation. And then I will turn to our panelists and ask them to say what it is that strikes them about the novel, whether it's a theme or an idea or a scene or a character that moved them in some way in their lives as health professionals. So a few of the things that came up. First of all, we talked about the novel and the way it's reappeared for us in times of pandemic since its first publication in 1948. I've talked about this with a variety of audiences, but you know that it had a resurgence in sales and popularity in 2015 during Ebola, and it had particular resonance in the 1980s during the AIDS epidemic. And I'll just briefly talk about that. I know there's a lot of interest there. AIDS was first diagnosed in the United States in 1981 when 5 gay men, otherwise healthy gay young men in Los Angeles, came down with this mysterious pneumonia. And the CDC and a variety of doctors got together and were very puzzled by this disease. 3 of those men died within 12 months of their diagnosis of this strange pneumonia, which didn't yet have a name. And then we saw evidence of what later we come to know as AIDS, HIV, in New York City. And then a lot of activity in and around the club scene in London. And the reasons I'm taking such pains to mention this is because this pandemic had a lot in common, and it had a lot very dissimilar with our current COVID outbreak, and with the kind of plague that Camus is writing about in the novel. One of the similarities is the absolute stigma that we saw during the AIDS epidemic. For the first few years before it was fully understood, it was called the gay plague by the media and by health professionals. And this gay plague, this moniker was an attempt to discredit it and to stigmatize the people who were suffering from it. And of course, we know the earliest populations to suffer from AIDS was gay populations. There was a lot of misinformation. There was not a lot of solid information for several years. In fact, I've read some interviews with men in London at the time who survived AIDS, and one of their big public health efforts was don't sleep with anyone who's American. And if you go to America, don't sleep with anyone because it's an American plague. Because it was first identified in the United States. Then, of course, it became, it was earliest called GRID, G-R-I-D, gay-related immunodisease, or gay-related immunodeficiency was the earliest name for AIDS. And then in 1983, the HIV, the immunodeficiency was discovered, and the very first AIDS ward was opened at San Francisco General Hospital. But it wasn't until 1987, and if you were diagnosed with AIDS, you could be expected to live 15 months. There was no cure, there was no treatment, it was extremely mysterious, and it was extremely stigmatized until 1985. And in 1985, two really interesting things happened. The era's Brad Pitt, whose name was Rock Hudson, was diagnosed publicly with AIDS, and he came out as gay at the same time. And this shone the light and a lot of attention on the epidemic. And also in 1985, something really curious happened in public culture. Imagine this. For those of you who are old enough to remember television ratings, it's Monday Night Football. But that same night, as a big Monday Night Football game, there was the first ever TV special about AIDS, and it was called Early Frost. And it starred Aidan Quinn, who played a gay man who has not yet come out, but who is beginning to suffer signs of AIDS. And so, because there was so much media attention to the AIDS epidemic, Early Frost, made-for-TV movie, won out on the TV ratings over Monday Night Football at the time. And because of this popular attention, and because of Rock Hudson, there came to be more and more attention paid in research communities as well. And in 1987, the AZT drug therapy was developed, but it cost $8,000 a year to get that treatment. And imagine how many people did not have the insurance to cover that. Now, at the time, there was a young scientist who was working for the NIH, who was straight and was Catholic, but was a great ally of the gay community. And he sat down to listen to a lot of people in the gay community, including the great Larry Kramer. And he was convinced that if more health professionals listened to the people suffering from the disease, there could be some great developments, right? But it was especially in his efforts to make the drug trials more readily available that eventually by 1989 finally brought down the cost of the AZT drug. And that young scientist, this experience changed his career, and he went on to serve 6 presidents as an epidemiologist. I wonder if anyone knows who that fellow is. I know you've heard his name. Yes, Megan, it is Fauci. In fact, it is Anthony Fauci. Yeah, so he became, he had a contentious relationship with the community suffering from AIDS, but in the end, he championed their cause and got the serum approved and manageable costs. So now being diagnosed with HIV is not a death sentence like it used to be. So I know I've spent quite a lot of time, but I know that there's a lot of interest out there because Camus' novel, The Plague, gained quite a following during the AIDS epidemic of the 1980s, particularly because there was so much unknown and so much stigma that I think communities all over the world turned to the humanities and to this novel in particular to help make sense of what was going on. All right, so without further ado, I'd like to ask our panelists to talk about what this novel might mean to them, what ideas or themes or scenes seemed resonant. And we'll start with Sam, and then we'll go to Linda. So go ahead, Dr. Sabo, thank you.
Thank you so much, Joya and Julie and Dean Bauer. I was able to attend the first evening with this book, and I hadn't read the book. And so I felt like I truly enjoyed that evening. And it really prepped me to think really critically about the book and from a different space. And so I do truly appreciate the opportunity to be here and learn together as this interdisciplinary space that we need to come together to manage what we're facing now today. And I guess I just wanted to start, there's so many ways to slice this pie, but I wanted to, because we're in an audience that might not know what public health is, and I just wanted to kind of start with something that really resonated with me as a public health professional. And so for me, public health, it's not medicine in the sense that I'm not treating individuals with illness, but my job, and I would say that Mayor as well, we are in the business of prevention, right? So we're in the business of making you do things you don't want to do, oftentimes through policy and legislation to protect you from illness and disease. So that's kind of my space that I think about public health in. And I want to draw your attention to page 134, the character who really, for me, resonated in what the spirit of a public health person is Grand. And on this page, our narrator, who we know who it is now, he's saying, from this angle, the narrator holds that more than Roe and Tarot, Grand was the true embodiment of the quiet courage that inspired the sanitary groups. And I read sanitary groups as public health. He had said yes without a moment's hesitation, and with the large-heartedness that was a second nature with him. All he asked was just to be allotted light duties, right? So he's got some reservations. When Rue thanked him with some warmth, he seemed surprised, and he says, and I think this is what struck me as Grand and the public health profession that I truly hope that we can all rise to become, is he says, "Why, that's not difficult. The plague is here. And we've got to make a stand. That's obvious. I only wish everything were as simple." And so I just wanted to kind of recognize that we're in a different kind of space, and public health is really that. It's that's how I felt when this started in March. I felt like I needed to step up. I felt like I had some skills to offer. And I truly know that the panelists on this evening are also those people that without hesitation, like Grand, just said, yes, let's go, tell me what I got to do. And I will say, for all of you that are new to public health, that there's different sections of public health. So infectious disease is a thing, and I am not an infectious disease person. I like the chronic disease. I like the slow moving chronic disease, heart disease, diabetes. I like to think about things and work on policies and structures to stop them. but infectious is fast moving, and that is a different being of people. And I really enjoy the way that Grand is and what he embodies. So that's what kind of stood out for me initially. Oh, you're on mute, Joya.
Yeah, thank you so much, Sam. And we will definitely have time for plenty of questions, but I'll just go ahead and point out that Lucas has a question, and this might be a sort of slow-moving question that we address during the course of the evening for those of us not in public health. How can we also step up? So that's a great question, Lucas. Thank you. I'd like to turn to Dr. Linda Ransdale now, and so she can tell us a little bit about what the novel means to her as a health professional.
Well, I just want to give a shout out again to the other panelists, because Sam and others on the panel are prime examples of people who are crunching numbers, they're analyzing data, they're providing information to the health department and to the state about what's going on in Northern Arizona with this pandemic. So it's a heavy lift, and this is in addition to everything else they're doing in terms of research and teaching. So I would give them a raise the roof for sure. So it's a hard act to follow. Anyway, thanks, Sam. You know, when Joya asked me to read the book, I thought, okay, I've been a dean now or an administrator for about 8 years. So the chance for me to read a novel, twist my arm, right? Instead of write an email or, you know, read the Chronicle of Higher Education or something like that. And I just took a couple notes before I go to my quote that I wanted to share with you all as English folks who I think will appreciate this. First, you know, if you think about the fact that this novel was written in French and translated, in my opinion, some of the passages and some of the writing was brilliant. And so to take it from French and translate it to English, that in itself is a phenomenal skill. The other thing that really struck me is, as I was reading this, and I'm sure you all felt the same way, it takes you through a range of emotions. And when you read a novel and it takes you through this entire range of emotions and it makes you think critically and carefully about things, that's an important contribution of the humanities to society. And I want to recognize that, because it became crystal clear to me as I was reading this novel and feeling all the feelings and thinking about all the questions and problems and, you know, how can we prevent history from recurring, right? Or from repeating itself with some of the things that we're learning in this novel. And then the other thing that I just wanted to share with you, which I thought was kind of funny, and I think about this a lot as a person in the health professions, you know, I had to have a dictionary with me. So when I was growing up, my mom, I would ask her, what does this mean? How do you spell this? And she'd be like, get your dictionary out. And we don't do that anymore, because you can just look it up on your phone, right? Or it will auto correct for you automatically. And I think there's a lot of value to learning different vocabulary. So I wrote some funny words, well, not funny words, but words that I had to look up, because I'm used to using plantar fascia and biceps brachii and quadriceps and, you know, things like that. But some of the words that I wrote down: declension, confabulated, redolent, and I'm probably pronouncing it wrong, so, you know, try not to laugh too much. Bale fires, recrudescing, you know, and I could go on and on, but that to me was interesting. And it's always good to learn, right? To continue to learn. So my passage, if you turn to page 71, and I have to give you just a tiny bit of context behind this. My mom is 91, and she is in a skilled care facility right now. And you can imagine the panic that arose in me when this whole thing erupted. It is probably the most difficult thing I've ever had to do, to not be able to see her, to not be able to hug her, you know. And so, in fact, I had today about the 4th face-to-face visit that I've been able to have with her, which, you know, if you think about the importance of your mom in your life and not being able to see her during one of the hardest times of our lifetime. So my quote is, This drastic, clean-cut deprivation and our complete ignorance of what the future held in store had taken us unawares. We were unable to react against the mute appeal of presences, still so near and already so far, which haunted us day long. In fact, our suffering was twofold, our own to start with, and then our imagined suffering of the absent one. And in my case, it was my mom. And then the other part, if you skip down a couple paragraphs, the sensation of a void within which never left us, that irrational longing to hark back to the past, or else to speed up the march of time, and those keen shafts of memory that stung like fire.
Thank you, Linda. We had a good conversation, an opening of a good conversation, I think, when we met last Thursday as a group, and we talked about this notion of exile and how it was a feature of the disease. And I think if we look throughout history, we see that this idea of exile is compounded by the colonial situation in the novel, by the fact that Iran's borders have closed, separating many people from their loved ones. But we can also see it as a feature of many pandemics throughout history, this feeling of exile. And one of the things that becomes clear with a close reading of the novel is that the nature of this exile is that if you're not in it with us, you just don't understand, and thus we feel so alone. So I think this is a beautiful rendering of all those complex emotions. Next, Dr. Sandy Smith, who is our NAU Campus Health Director. Dr. Smith, what resonates for you in particular in the novel?
Thanks. So there were so many things in this book that resonated with me, and it was really hard for me to pick because it felt like so much of it seems contemporary, even though it was 80 years ago. And so I had a couple different options, but the one I am gonna talk about first really is, there was a spot on page 127, which I think applies to me certainly when I was in college, because I wasn't somebody who knew when I was 5 years old that I wanted to go into medicine. I was somebody who sort of took a while to find my path there. And so at this point, Dr. Rowe was saying, I entered this profession, when I entered this profession, I did it abstractly, so to speak, because I had a desire for it, because it meant a career like another, one that young men often aspire to.
Oops, you're muted, Sandy. You were muted that last part. We got a one that often aspired to.
Thank you, sorry.
No worries.
Let's see. Oh, one that young men often aspire to, and perhaps too because it was particularly difficult for a workman's son like myself. And then I had to see people die. So like I said, when I went into undergrad, I was going to become a researcher. I was actually going to do research on AIDS. And then I decided after a while that I didn't really want to do that. Then I thought I would teach for a while. And then I decided I didn't really want to do that. And so when I started medical school, it was, again, a good idea, felt like a predictable job. I could make some money. I'm a workman's daughter. Didn't have a legacy of being a physician my whole life, or this was what was expected of me. And so that part of it really spoke to me in the beginning. And then there's so many other parts that just are still a part of how we deal with plagues and how we deal with certainly this current one, and that we'll come to that later.
Yeah, great. Thank you. Thank you, Sandy. I hope we do come to all that later. Sandy and all of these panelists shared with me some really incredible insights. Now we'll turn to Meir Schumacher, who is an epidemiologist and who does a lot of data crunching and a lot of other things, and has had quite a long history in public health herself. So Meir, what part of the book, scene, theme, idea, perhaps resonated with you or struck you in an uncanny way?
So I definitely loved the parts about data. So even the narrator says you can't tell a good historian without data. And I just want folks to think about what is data, what counts as data these days, how do you know whether it's good or bad? Because I think that's been a huge, huge issue with COVID-19. I also want to tell you a little story, and then I'll bring it back to the book, I promise. One more thing too. We have plague in Northern Arizona. Yeah. I just want to freak you all out. We do have plague. I do want to say, here's the good, that's the bad news. The good news is actually these days, you can knock it out with antibiotics. So if you think you've been exposed to fleas, you should go on fever watch. And then you tell your doctor that you think you may have been exposed, and then they give you antibiotics and everything's hunky-dory. We haven't had a death since 2008, unless we've had one in the last couple of years that I don't know about, but just for the record. The reason I say that is because my partner is a hypochondriac, and if we start talking about any medical issue of any kind, any illness, he will think that he has it unless I reassure him that there is a cure. Okay, moving on. So that's for the rest of you hypochondriacs in the group. Moving on. So I just want to tell you about one of the many outbreaks I have worked in the past. And this is not atypical at all. The specifics are atypical, but this kind of trajectory is not atypical. So one Sunday at 5 o'clock, I got a call. There are several kids, 6th graders, in the emergency room at what then was the Flagstaff Medical Center. And they're really sick, and all the parents are talking about it, and they say the emergency department is just filled with these kids. So at first, that's all we knew. Called the hospital right away, and because we are public health people, we can share information with the hospital. That is in order to be able to protect the public, of course. And so we started calling some of the people who were ill, and we found out that 3 of these kids, or 2 maybe by that point, had gone to Camp Colton. Camp Colton is where every 6th grader in Flagstaff gets to go for a week of outdoor education. It's totally a blast. All the kids look forward to it. I'm sure there are many parents who use it as the carrot on the stick to, you don't get to go unless you do your homework kind of thing. And so here we are thinking, oh no, this place has possibly exposed every 6th grader in Flagstaff. And by the way, this was in the newspaper, so I'm not speaking of something that's confidential. So we start asking, we get a hold of the camp, we say, what's the camp set up like? And they were telling us about these kind of wood frame tents that have canvas over them. And you stay in those, it's kind of like you have bunk beds in those with your sleeping bags. Well, it clicks in my mind, I had just seen a presentation about hantavirus. And those of you who don't know about hantavirus and are now not scared of plague, I'm gonna scare you, because hantavirus kills 30% of the people that we know get it. 30%. Now that's very, very high. That is, other than maybe rabies and a couple of other things, that's about as high as you can get. We call that a case fatality rate. So of all the people we know who have it, how many die? So we find out about that, and it clicks in my mind, you know what? There are these tents at Yosemite that people stayed in, got hantavirus, and there were 12 deaths and counting at the time. And so I panicked, because you do not want a big group of 6th graders, or any graders for that matter, to be getting hantavirus. So this is all the information we have at the time. What do we do? What do we do? Do we close down the camp? We don't know if anyone has hantavirus. If we close down the camp, is it going to ruin that camp forever? No parent will ever let their kid go back to that camp? Is it going to have to be closed down forever? What if these kids have flu? What if they caught flu from each other at camp and that's why they're in the emergency department? We don't know. So one of my favorite passages was in was on page, I think it's around 46, 47. I was reading it on a Kindle, so it's a little hard to figure out, but so Dr. Richard, who is the head of the Medical Association, early on, he's talking about the epidemic, and he says, and the narrator says, in his opinion, the great thing to do was not to take an alarmist view. It would be wise to await the statistical report on the series of analyses that had been going on for several days. And the reason I love that is because in every outbreak I've ever worked, in any outbreak I've ever studied, you make decisions 20 times along the way about what you're going to share and what you're not, based on insufficient information. So I admitted to Joya that early on when COVID was only in, oh, I see the hypochondriacs in the chat room are discussing how you get Hantavirus because they're worried about it. So I'll come back to that. So, so when COVID actually started in China, I really thought China would be able to contain it. They have a fairly sophisticated medical system. They have scientists, they're very science-based, et cetera, and I really thought they'd be able to contain it. We meaning public health, have contained SARS, have contained Ebola and other things. And early on, it's a good thing I wasn't the head of the CDC because I thought that they could probably contain it. And of course, it turns out they didn't. But I also didn't have all the information. But back to what I was saying before, you never have all the information. So it's Donald Trump and I do not agree on a lot of things. However, it's hard for me to point at him and say, he should have acted sooner when we didn't really have all the information. I still think I could probably go out on a limb here and say he should have acted sooner than he ended up acting and not wearing a mask and other things like that. I don't agree with. But I also know how hard it is to be the person making the call and trying to decide, do we alarm everyone? Do we put practices into place? Do we have enough data to do it? And I'll stop there, but I will tell you, hantavirus comes from inhaling aerosolized mouse urine or feces, which one of you knew the answer to that, so thank you. And it was not hantavirus. It ended up being tick-borne relapsing fever, which luckily does not spread person to person. It was because a few of the kids got bitten by ticks. Again, it is very treatable and was treated. Everyone was absolutely fine and did not have any lasting results from that. And they did have to close for a while, but Camp Colton is now back up again and operating. I'll stop there.
Thanks, Mare. My biggest fear is actually ticks, so thanks for that. Appreciate you. Now, last but not least, Dr. Ann Newland. Dr. Newland, welcome. What about the novel resonates for you? I know you've had, you are now an administrator at Northland, sorry?
North Country.
Yeah. North Countries, thank you. And you've also worked in Kayenta. And so what about the novel sort of speaks to you, a scene idea?
Well, you know, I really appreciate the opportunity to be part of this panel and to kind of get the kick in the pants to read this novel for the first time, because I probably should have read it when I was 19, when I was the age of most of the people in this class, but it never quite got there. So one of the things that was in my head as I was reading it, because, you know, now at the grand old age of 52, with years of practicing as a physician, of practicing on the res, of, you know, knowing so many people who've been personally and professionally impacted by COVID-19, I just read it with very different eyes. And there were so many things I underlined, and I also did it on an ebook, so my pages aren't going to necessarily match up with the class's pages. But the quote that I would like to highlight came just a little bit after the one that Dr. Sandy Smith mentioned, where Ryu was talking about how he went into the profession of medicine. You know, that section of the novel is a deep conversation between Tarot and Ryu about religion. They're talking a little bit about that Father Pantalou's first sermon, which is so horrible, basically saying that the plague is visited upon these people to punish them. And Ryu talks about how he doesn't believe, not necessarily there, but he really doesn't believe in collective punishment, maybe doesn't believe in God. And Tarot is asking him why he keeps on fighting, even when, you know, he's just gonna lose in the end. And he says, well, that's all there is to do. And at the end, Tarot asks him, well, who taught you all that, doctor? And the answer came immediately, misery. In my translation, it's misery. In yours, it might be suffering. And I think it's being the witness to suffering and human misery that that gives Ryu the legitimacy to be the narrator in this story. So he's bearing witness to what's happening to people. And, you know, sometimes like now I'm in administration, I actually stopped seeing patients back in November. That was a big decision, but you know, your work changes over time, and mine has had to change over time too. But in a number of meetings, like here, both here and then stuff I've participated in nationally about social justice and COVID-19. I've talked about what's happened on the Navajo reservation, and I haven't been there in those places as the disease unfolded, but my social media is blowing up with stories about that. My friends who are working on the front lines have sent me stories of when the helicopters came in and to deliver supplies at Tuba City, setting up a field hospital in Chinle. And when the outbreak happened, it started on the reservation in March. It was at a church meeting in a little tiny community called Chilchimbito. And Chilchimbito's about 23 miles-ish away from Kayenta. And it's on this very pretty stretch of highway. So if you head from Kayenta east, like you're heading to Farmington, you head ahead on one stretch of highway, and then there's a turn where you can head south, and it's actually this little road to Chinle. And if you ever have a chance to drive it, I would. It's one of the most beautiful little drives on the reservation. And Chilchimbito is just this tiny, tiny little community. And when I lived there, another community health center, Canyonlands, which is based in Page, had a clinic there in what used to be an old chicken coop. And now they've got a nicer new double wide out there, but it's, you know, this is a whistle stop. There's not even a gas station in Chilchimbito. And there was a church meeting there. So people from all over the res, particularly in the Western agency, the Western part, came to this church meeting. So people from communities like Navajo Mountain and Gray Mountain and Tuba City, and areas around there all came to this church meeting. And that was the super spreader event that set off the outbreak on the Navajo reservation. And when the cases were first recognized in Kayenta, you know, at first people didn't believe it could be COVID-19. This was still relatively early. And so people were sick, but they came and got seen and got sent away. And then, you know, ultimately died. Between myself and my partner, we know 7 people who've died from COVID-19, all from the reservation. And, you know, these are healthcare workers, school teachers, special ed teachers. You know, it's horrible when you see the impact of the disease on these small communities. And when I've been in some regional meetings, and I won't identify which ones, but just frankly where people should know better, you know? Each of these lives matters. When we talk about numbers of people who contract COVID-19 and the numbers of people who died, 200,000, more than 200,000 Americans have died from this disease. And that's a tragedy. But we can't, it's so hard for us to absorb what those numbers mean. And that's why telling the story is really important. So for me, that's why Ryu can say, what taught me all this? It's misery, and it's why he feels compelled to tell this story, to write this story.
Yeah. Thank you, Dr. Newland. Indeed, and we have talked about the way that chronicling, being the one who stays to tell the story, is an important recurring theme that comes up throughout the novel, in fact. There's some great stuff happening on the chat. Let's see, Rose asks, I've been thinking about these illnesses and the view of someone who felt, who felt with the aftermath, not as someone who had to make the calls in the beginning. So this is a great, this is why we're together now, so we can sort of expand our points of view. What about any other comments? I see that Mayor responded to Rose. Other comments for Rose? Seeing this disease, seeing COVID from the person making the calls at the outset. What's difficult? What is especially challenging? Dr. Newland said, these are about people's lives, but what else? Is there correspondence between the novel and your experience as being someone having to make these calls, as Mayor says, maybe without as much information as you would like?
I think it's an interesting question about making the call, because I would say that in a lot of situations, whether it's a medical emergency or even a business urgency or emergency, you never have all the information. Mm-hmm. You have to make the best call you can with about 80% of the information, and you just keep going, right? And I can see Mayor nodding and agreeing. When I saw the reports coming out of China, I thought, oh no. And like Mayor, I thought, but the Chinese can contain it. We contain SARS. But when I saw Italy get overwhelmed, I thought, we're in for it. And I didn't know how it would come, but I knew it would be very serious, that it had the potential to have a huge impact on us, and that we had to prepare. So like at North Country, we had teams. Initially, we would meet as a management team twice a week during the early part of the crisis. And then we were able to back off to once a week. But we were standing up so much and working on protocols, and, those two meetings doesn't encompass all the work we did to be ready. So you never have all the information. And you have to be very nimble and agile and be willing to be wrong. I didn't think that cloth masks were going to be a good idea, but you know what? I was proved wrong, and that's okay. You have to be okay with being proven wrong.
Yeah, thank you.
I would just build on that. The idea of flexibility and nimbleness is something so extraordinarily important in times like this. But also this idea, and I think that Camus really comes through in this novel that maybe we have a lot to learn from, is this idea of reverence for an extremely finicky and dangerous virus. Mm-hmm. So the reverence for virus is something I don't think us as Americans really have had to deal with as a collective. Mm-hmm. And then to take that step of like, we cannot, that idea of individual kind of, we'll beat this, and this American kind of psyche of if you just work hard enough, and if you just, keep going. I remember at certain points when we were supporting different entities and trying to think about advising the movement and different different policies related to areas of our world, when people wouldn't listen and couldn't hear and couldn't kind of take a step back and have reverence for what was to come. And then making decisions on 80% information is always a good thing, because that's all we've got oftentimes in health or medicine. But then when that 80% is still not totally believed and pushed back upon, and I think Ann said it well, you know, talking to people that should know better, but yet can't for some reason act on that advice. That's challenging.
Yeah.
I think there are two things happening simultaneously. One did happen with AIDS before, but it is the only time I've seen a disease so politicized with AIDS. Otherwise, I mean, let's face it, flu isn't very political. There aren't any sides for flu, are there? There aren't any sides for, you know, tick-borne relapsing fever. So I guess with vaccinations, we've had sides being taken, being drawn that way. So that's, and that combined with social media is a very dangerous combination, because there will be lots of false information spread. So now we're no longer, this was what I was saying about data before. So now we're no longer dealing with 80% data, and we're missing some. We're dealing with 40% incorrect data, 40% correct data, 20% not sure if it's correct or incorrect, and then people classifying those differently, right? So it's been kind of a free-for-all on making decisions, because we have some left views, some right views, and then social media, rather than one accepted, let's say, truth.
Yeah, thank you. I appreciate that. And I love this idea about having reverence for the virus too. And I think that, you know, Sam and Mare make some really excellent points that, you know, there's what we know about this virus, and there's reverence to be had about what we know, but then there's the politicization of it. And one of the things that's interesting to me about the novel itself is, you know, we don't have this is a pre-polio vaccine novel, okay? Polio, one of the biggest global threats, you know, in public health before the 1950s, before the vaccine. And so I'm super interested in what the health professionals think about this serum, you know, that they keep waiting to get, and is this serum the right serum, and is this serum going to treat it? And it has to come via the prefect, who of course is the colonial administrator in this colonial, you know, city. And so there's that and knowing that Camus wrote this before the polio vaccine gave relief to so many millions of people around the world. And then of course, vaccines become politicized. And I'll just draw our attention to page 46 to sort of, you know, support this conversation further and support this question. Dr. Ryu is trying to convince the prefect, who of course is the regional representative, the France's representative in the colony, that there is potentially a plague in the works. And Ryu says, all the rest is a matter of administrative action. And I need to remind you that our Constitution has provided for such emergencies by empowering prefects to issue the necessary orders. Quite true, the prefect assented, but I shall need your professional declaration that the epidemic is one of plague. And they go back and forth about what to call it and how to communicate this threat. So I guess, you know, my question is multifold, right? The politicization, communicating science in a political environment, a political context. Doesn't seem to be an issue in Iran necessarily, but it's certainly an issue for us now. So as health professionals, what have you seen in terms of the vaccine, conversations about the serum in the novel and in your work, and conversations about how to communicate science? Yeah, go ahead. Sorry, I just point out that Jordan says in the chat, it's an issue endemic to politics. As soon as a politician says, I don't know, they're through. Yeah, exactly, because there's that next election to count on. Dr. Newland, I see you have something.
I think communication has to always be done thoughtfully. And as a primary care physician, when I'm talking with a patient, you have to be able to make very complex information clear and understandable. And there's no reason why you can't explain things in a way that that a person who's receptive to the information can understand. And I think this is one of the reasons why, as part of emergency operations plans, you designate who's going to be your point person for communication, because you have to think through that messaging. And Ryu is probably blindsided in talking with the prefect. The prefect is just thinking, how do I make this, how do I massage this? How do I make this palatable? Because I'm giving people information they don't want to hear. And I bet Ryu was not ready for that conversation at that moment.
Thank you.
The other thing that go ahead, Mayor.
Well, as health people and public health people, of course, we're going to take the stance of being more conservative about not letting spread happen. But the administrative side, and let's look at boards of education, schools, and businesses right now. Big pushback because they would like to reopen.
Yeah, yeah.
I would just add that, in my opinion, in addition to having very thoughtful messages, as Ann mentioned, I think consistency is important, and communicating systematically with folks around you is important. So in other words, if it's a shotgun approach and there's a lot of inconsistencies, it makes it very difficult to act thoughtfully.
And then compounded with what Mayor identifies as the trouble with social media and the proliferation of half-baked information. Yeah.
And I probably would just add to this, if you think about public health generally, it's extremely underfunded. Like bare bones. We do not invest in prevention as a country. We invest in sickness. And so communication campaigns are extremely expensive. I mean, we know it, we live it, we're inundated with communication all the time in terms of advertising, and that industry is really well-funded and a well-oiled machine, and public health has often suffered from the anemic, ability to communicate because we just don't have the resources. And I'll say in this kind of situation, if you think about when you started to see true public health campaigns like billboards that looked legit, like had photos and had a saying and something, I think that has only been in the last probably month or a month and a half, maybe. Most of the stuff that we weren't given a national strategy for communication, oftentimes that comes from the Centers for Disease Control. We count on the Centers for Disease Control for all of these messages that we utilize at the local level, because oftentimes they've been vetted, they're literacy appropriate, they're culturally appropriate in terms of regionality and race and ethnicity and kind of population-based messaging. We never got that. And so then it was up to these local, rural, oftentimes rural, and we steal from the metropolitan areas too, but to be able to produce this level of communication is a whole nother infrastructure that was really not in place at the federal level. So a lot of times the communication will come down, right? So when we have big rollouts of, big campaigns to stop smoking, you can think of all the different public health measures, wear your seatbelt, put your kid in a car seat, use a condom, all that stuff. All that stuff has oftentimes comes from the feds. And so I think that's something that we also lacked, which also sucked time, energy, and resources from local public health professionals and medical providers to produce that information. And that was challenging, and we're paying for it right now, because now what's being invested in, and I'm often on multiple calls a day from the National Institutes of Health, is now correcting the misinformation and medical mistrust that has generated in our population, that now we have to somehow overcome to convince everybody that when a vaccine is ready, you should take it. So now we've hurt ourselves in so many ways. And I think I said reverence, but I also mean trust. The public trust has been lost in this evolution of COVID-19, and it's going to take so much work to get it back, to get our people back believing in science and in precautionary behaviors.
Thanks.
Can you imagine if we had spent the money that has been spent on these false political campaigns on public health messaging, and just put our money and priorities elsewhere, how differently this pandemic may have played out.
Yeah, thanks for that. There's some good stuff happening in the chat, and I see that Dr. Walker has a question. So go ahead, Nicole, please.
Yeah. I'm on mute. Off mute. Hey, thank you all so much for coming. And I think this is the beginning of a great conversation. I can imagine where we're going to go tonight. But one of the things I understand is so difficult about public health and about getting the message out is if public health does its job well, then their job is invisible. Right. So if we'd been very proactive and on top of the coronavirus, it would have been thanks to things like communicating well across all these areas and knowing a little bit more in advance about what might work and implementing those things and having that trust and having that sense of reverence for the disease. And then everybody would have been like, oh, what didn't even happen? Nothing happened. What was all that work for? And so I just mostly raising my hand to say it's a really difficult job because your communication and your success always results in nothing happening. And that's what you really want is absence, right? You want nothing. And you don't have a lot to show for nothing. So I just work that you do. And I know that in other times there has been great success in having nothing happen. And maybe that it's hard to get trust back, right? If you're like, look, nothing over here. So I hear you about it's going to be an uphill battle.
That's such a great point, Nicole. Thank you. And Dr. Rui points out, too, in terms of communicating information, the information about plague in the novel was written in the newspaper in a quote-unquote harmless guise, and some little white posters were stuck in the least obtrusive corners of the town. And it's basically a political campaign, she says, of covering the prefix bases. He can now say he told people about the plague, and at the same time, he is avoiding upsetting anyone. And it's very political, and it is a type of misinformation. I think that's a really great point.
Yeah, I like when they, on 113, when they're talking about, oh, the newspapers and the authorities are playing ball with this plague.
Yes.
They fancy they're scoring off it because their numbers are essentially going down. So I really like thinking about it as a game.
Yeah.
Scoring points.
Yeah. And, on that same page, there's something about data. And, Mayor confesses to love the whole data stuff. And needless to say, he outlines the progress of the plague, and he too notes that a new phase of the epidemic was ushered in when the radio announced no longer weekly totals, but 92, 107, and 137 deaths in a day. The newspapers and the authorities are playing ball with the plague, right? Exactly. So they're switching the way that they're reporting data, which I think is really interesting. Let's see, there's something interesting from John McGregor early on. Let's see if I can find it. How do you combat a population that is not receptive to information? I think this is such a great question and not one to be taken lightly. Does any
I want to ask everyone in the chat room if some of you will weigh in. Are you sick of information? Are you not receptive to information? Do you not trust it? Like, tell us tell me, I'm going to do my own little, you know, research here. Just weigh in there and let us know. On what? We don't have to wait for that, but yeah, there's definitely in a plague situation, when you start reporting how many by day, it starts getting, you know, you're really moving. The other thing that I've learned in communication about health issues is to try to put it in terms that people understand, which is hard for a lot of scientists to do. So this gets back to that discussion of intersection between science and literature and everything else and how important it is. I looked up how many people would die in the US if we just let it go and had herd immunity. We just let it go, right? Just let it spread. And what I came up with was a number. But what that number is 2 747s shot down every day for the rest of the year. That's how many people we lose. And actually, it's probably more like 3 now because I did this earlier in the year. And when you think of it that way, wow. I mean, would you really want to let it go to herd immunity knowing that it would be the equivalent of 2 jumbo jets every day? I don't think any politician would go for it if we worded it that way.
Yeah, thanks, Mayor. And I'm glad you're doing this sort of research. And there was a lot of responses that came up in the chat. Do you want more information? Kimberly said, that's why I'm here. And Rose said, I like getting more information on cover, spread, and prevention. I want as much info as is available. It can feel overwhelming and depressing, but I don't want to be kept in the dark. And then Leah says, I don't trust the politician to tell me my scientific info. And Simka says, I pick my sources cautiously. So this is all really good stuff, I think. Patricia says, I know it's real, but I don't know who or what to believe. I also try to stay away from confirmation bias. I know a lot of people who use their own judgment to believe what is true, but it could not be. So what do you think about confirmation bias in this context?
It's real.
Yeah. Great.
I was just going to say, one of the other things that I think that's tough about public health is that the majority of the time, right, they're asking people to do things that they don't want to do. And so that's one of the things that makes it hard with COVID too, is that everything we're going to recommend is not going to be fun, and no one really wants to do it. Otherwise, it would be easy and we would all just do it. And the last piece that I kind of want to say about that whole thing is, not only are the airplanes going down, but we don't know what the long-term effects of COVID are going to be, right? We know that in some populations, 60% of people have cardiomyopathy that exists for a period of time after that. Some populations, does that mean that half of the people that are surviving with asymptomatic COVID are going to have heart problems in 2 years or 5 years or 10 years or 2 weeks? We don't know any of that. And so this is really hard because it's happening so fast. And things are changing so fast, and we're getting so much data. And really, medical people like things to be kind of clean. We like it to be pretty straightforward and pretty obvious, and we like our data and we like our studies, and those take a long time to come out. And so to deal with stuff that changes super fast, where there's so many unknowns and there's so many uncertainties, is just really hard for everyone at the moment.
Yeah. Thanks, Sandy. That's great and so moving. And one of the things that Dr. Smith pointed out in our discussion last week to prep for this is over on page 192. And if I can draw your attention there, Dr. Ryu's task was no longer to cure, but to diagnose. And of course, Dr. Smith works at Campus Health, and she is in the business of, as Ryu says, to detect, to see, to describe, to register, and then to condemn. That was his present function. And I wonder if Sandy would be willing to talk about this. she was curious about how American society has prepared students to sacrifice for the good of the community, to sort of condemn students into quarantine or things like that. What was your interest in that passage, Sandy? I found that really moving as well.
Yeah, it's mostly that at this moment, right, because there is no treatment for COVID, what we're doing when we tell people they're positive is telling them to isolate or telling them to quarantine if they were exposed. And so none of that is very fun. And I'm sure as students in the class that you're aware of people that have already been put in isolation or people that had to be quarantined. And it's horrific. It's not fun. You're away from everyone. You're by yourself. There's really not much to do. You can't hang out. You can communicate, which, you know, don't get me wrong, is great that there is Skype and Zoom and all these different ways to communicate with people, but it's still very isolating by definition, right? And I feel like a lot of our American culture is based on individualism and taking care of yourself. And this whole response to a virus or an infection or a pandemic is not that. It's not so much just take care of yourself, it's take care of your family, worry about your grandmother, worry about your teacher that you love, worry about, because, you know, fortunately, most students in the 18 to 24 zone are generally healthy and doing pretty well with this, but they're also out there exposing people if they're out there exposing people.
Thank you. Yeah, thanks. Rose, go ahead, please.
Oh, somebody else.
Hello.
I see Rose's hand up. Yeah, go ahead, Rose.
I just wanted to put out there, someone had mentioned, I can't remember who anymore, but someone had mentioned the effect that it would have on college students. And speaking from personal experience, I just want to remind everyone that when you're in college, you likely have at least one roommate, usually more than one. And we're at a time in our life where a lot of us need to be, you know, having part-time jobs or doing something to save up money for the next step in our lives. And it's really hard to find a balance knowing that you can't ask your roommate to not do that, just like your roommate can't ask you to not do that. But then when one of you might get exposed, suddenly your entire house or your entire apartment has to isolate, and you're all suddenly at risk just because of one potential exposure. And I've been through it, and it's hard. And then it's also hard because you can't be mad at your roommate, like this is just what's going on. And I wouldn't want to be mad at them, but there's still frustration that it's not something that you can change and it's not something that you can fix.
Yeah, thanks, Rose. That's a great follow-up to Dr. Smith's observation, for sure. There's some good stuff happening in the chat. Are there any practices you would like to see continue once the US, quote unquote, gets over COVID, besides washing hands, right? Of course. And then also some comments on the politicization of mask wearing. It's become so extreme. Do we see this in the novel at all? And also, Dr. Rui says, I'm concerned now that the vaccine has been politicized. I worry that it will have been rushed, not fully tested. I'm a big believer in vaccines, and I hate that we're now questioning the vaccine. So a variety of things to weigh in on: the vaccine, the politicization of things like masks, and practices that we think you would like to see continue.
Just to start it off, I think about, you know, I wish I lived in Iran sometimes. I do. I want this to go away. I was so happy to get to the end, which I wasn't sure I was going to get to. When I got to it, I was like, oh, thank goodness. And everyone worked together, you know, everyone worked together. They did what they did what they were asked. I mean, the only instance, I think, if I remember correctly in the book that I saw was, you know, when Rampere wanted to leave and he just didn't feel like he belonged there. He wanted to go home to his wife, and he wanted to be, he wasn't of that community, and he truly tried to, that's the only instance that I remember where somebody was kind of trying to not participate in what was asked of them. And so, even though Oran is an ugly place, I sometimes, you know, thought, goodness, what would it be like if we all just worked together a little bit better?
Yeah. Yeah, thanks for that. And we know, you know, and even Rambert decides that he's going to throw his lot in with the place in which he's exiled. And I think it bears repeating that the very ending. Ryu remembered that such joy, Sam, is always imperiled. He knew what those jubilant crowds did not, but could have learned from books, that the plague bacillus never dies or disappears for good, that it can lie dormant for years and years in furniture and linen chests, that it bides its time in bedrooms, cellars, trunks, and bookshelves, and that perhaps the day would come when, for the bane and the enlightenment of men, it would rouse up its rats again and send them forth to die in a happy city. And I guess this relates to another question that came up in the chat. I think Genevieve's question, for the bane and enlightenment of men. So what have we learned during COVID that you would like to see continue for the enlightenment of us all? I mean, we're not through yet, but.
Well, I think it may be actually too early to say what learning do we want to continue on. In some ways, I think we're kind of at the end of the beginning of COVID. We're not even really in the middle of what this pandemic will be. And to circle back to some of your comments about the HIV epidemic and AIDS, you know, we would not have gay marriage without the AIDS crisis. There's a lot of things that would not have happened. I mean, I remember I lived in New York in the mid to late 80s and early 90s, and I remember when ACT UP was forming, the AIDS Coalition to Unleash Power. And even in medical school, it was a political act for me to wear a red ribbon, because that was a thing. Some of the students now might not remember that as a thing or know of that as a thing, to show solidarity with people with HIV and AIDS. And I went to medical school in Nebraska, and it was a political statement to wear a red ribbon in Western Nebraska and be conspicuous, or to work for the Nebraska AIDS Coalition and go to the Nebraska State Fair and offer information, right? That's a political act. So I think just pay attention. There may be some practices that we will want to carry forward, but so I'm going to make a prediction. I think we're going to see a higher level of political engagement and community engagement because of COVID-19. To Sam's point about people coming together, I've just felt rumblings and of people wanting to volunteer, and particularly people very early in their careers. Like, I don't usually get people in their 20s, early 30s deciding that they want to join the North Country Healthcare Foundation, but people are responding to that now, and that's very new and different. So I'm going to say it's a little too early, but activation, that's what I'm going to bet on.
That's so great, Ann. And I think that, you know, many of us who are observing and participating see that to be the case, particularly because of the way that COVID has once again, I mean, reminded privileged folks about the systemic inequities that exist. And people are really taking to the streets to protest those inequities in a way that is perhaps for the enlightenment, you know, as Ryu comments. There is something great in the chat too. Oh, Robin, thank you. Yeah, I think the pandemic has proven that accommodations can be made for disabled people who work better from home. This could be a lasting effect. Yeah, that's great. What else? What will continue for the enlightenment of men, as Ryu says? Because of COVID? What are your predictions?
I'd like to believe that way back in March and April, when people stayed home and started doing sort of weird projects because they were stuck at home. But some of that will continue. So my husband's obsessively making bagels now. Not that we don't like Biff's bagels, we love Biff's bagels, but it's kind of fun to make some stuff at home. And I'd like to believe that some of that will continue, and maybe some of the family bonding that happened with people because they couldn't go out and hang out with their friends.
Mhm, mhm. Yeah, thanks. Yeah. What else? Other questions, other topics, other things that the panelists want to share from the novel? Anything that seems really familiar? I think Sandy and others of you said, gosh, reading this novel felt so contemporary to me. What was it that felt so contemporary to you?
Maybe I could share, because you were starting to maybe go into this world of privilege,
Mhm.
you know, and we know that, you know, hospitalizations among African American, Latinx, and American Indian populations is 5 and 6 times that of whites in this country. And this is, as you say, Joya, just laying bare the deep structural inequalities that exist, social, economic, that underlie and undergird all public health issues. And so when I said that I love chronic disease, it's because chronic disease is extremely political. It has to do with structural inequalities, systemic racism, and those things. And we see that in infectious disease all the time, but I just didn't know because I didn't study infectious disease.
Mm-hmm.
And so I feel that, you know, that's something that we all need to recognize. And I think about I was on page 174, which really kind of spoke to me about inequality. So we don't see it a lot in this novel, right? We hear Camus telling us that there's the outskirts or the lowlands or the Algerian quarter, I think, I can't remember. So there is this a little whistle too, that there are inequalities going on, class issues or possibly immigration issues and things like that. But I think about on 174, there's I just think about just poverty in general and the work of disease. And so they say, you know, so about middle through, so much energy was expended on filling up forms and hunting around for supplies and lining up that people had no time to think of the manner in which others were dying around them, and they themselves would die one day. So just kind of that's the growing complications of our everyday life, which might have been an affliction, proved to be a blessing in disguise. So I think what I was taking away from that is the work, the extra unfair work that goes on in communities of color and in the lives of extremely poor people that makes it almost impossible to grieve, because I think I'm reading this in the context of grieving, and it's almost starting to talk about the process of burial and death, and having to lay to rest the people that were lost, and just that everyday grind of not even being able to take a moment to understand and reflect on the loss, the sheer loss of humanity. So think about that.
Thanks. Well said.
I don't think it's a coincidence that Black Lives Matter and COVID came at the same time. We pay a lot of lip service in public health to what we call the social determinants of health. And when I say lip service, I mean, we really want to address all of these things, and they affect so many issues of health. So I'm just going to read a couple: income level, education opportunities, gender inequality, racial segregation, all of these things, food insecurity, all these things affect people's disease status and their health status. And I think COVID really drove that home. And that if you live in a poorer neighborhood, if you have a job, as one of the people in the chat pointed out, if you have a job where you have to be face to face with people, things like that put you at risk for disease. And it's a luxury to be able to, for example, stay home and work and stay distanced from other people. I'm hoping maybe that some of those issues will carry on after we get a vaccine. I'm hoping.
Yeah, thanks. We just have a few minutes left to go. I see John. John, did you have something to say? I saw your box light up. John McGregor. Okay, well, jump in if you do. There's several things in terms of the health disparities that come up in the novel. There's one point early on where Ryu and I think Toru and Grand are together, and they're faced with the fact that they've run out of hospital space and they're gonna need some more hospital space. And there's a really interesting exchange where they reflect on the fact that they knew how poor people felt about hospitals. And this woman is resisting having her sick husband being sent to the hospitals. And she says, I don't want them to do their experiments on him. And this is a trap door into a very dark, dark history in terms of social inequity and medical research that I feel like is being alluded to here. So.
I don't think it even has to be a trapdoor into the past. It's
no, right.
Present, right? It's the lived experience for a lot of people of color when they seek medical care. And, you know, when I think of the experience of patients getting transferred from Kayenta Communities on the Res to Flagstaff Medical Center, and one of the advantages in town is a lot of the medical community don't know who I am. So if I go visit a family in the hospital and I'm just wearing, you know, jeans, t-shirt, and a baseball cap, they've got no idea who I am. And, you know, say a doctor will come in to give somebody an update, and I can hear them dodging the patient's questions. And then the patient, a friend of mine, will say, see, this is what's going on. I'm like, you're exactly right. He's not answering your questions. So there's a tremendous amount of mistrust because people get dismissed. Their concerns get dismissed. And I mean, there are cases of people who are predominantly Navajo speaking and they don't bring in an interpreter. And somebody might have, you know, be able to speak some English, but that doesn't mean they have the language to understand a medical condition, right? That they don't understand the medical vocabulary. And I had an exchange with a friend of mine in Denahotso. She was asking me about the vaccine, and she said, you know, President Nez talked about the vaccine, and he's going to let Johns Hopkins come in here and give it to us. And what do you think of that? And I said, well, I think it's okay. You know, Hopkins has done a lot of work on vaccines amongst the Navajo population because certain vaccines don't work as well in Athabascan tribes. And but we had a conversation. She was afraid of being experimented on and that they were going to test out a vaccine on the Navajos until it was, you know, good enough to give to others. So,
wow,
you know, you just have to be able to engage. And I said, now, even though Nez said that he will allow the vaccine to come in, that doesn't mean that individuals don't have to go through an individual consent process. And that reassured her. But, you know, it led to a big conversation.
Yeah, I think there was a lot of talk about the vaccine and trusting in the vaccine and how fast things are moving. And I would just 2 points, building off of what Ann is talking about right now. The National Institutes of Health, so Dr. Fauci, the famous Dr. Fauci, you know, head of NIAID, which is the National Institute of Infectious Disease, where a lot of these trials are emerging from. You know, they are extremely concerned because private companies conduct the trials, and oftentimes this is a private-public relationship. And what has happened is 80% of participants in many of the trials, there are hundreds of trials, not just vaccine, but therapeutics, other things to help you when you're in the hospital, different types of things. 80% of the vaccine trials right now, the participants are white. So the National Institutes of Health is extremely concerned because that is not representative of who is suffering. And Ann is saying, we need robust participation among diverse populations to be able to ensure that vaccines work appropriately, accurately for all people. And so that is something that the National Institutes of Health have doubled down on right now to really push universities like the Johns Hopkins of the world. We're funded as well with a consortium here in Arizona to really try and correct some of that misinformation, because the idea is it's ethical. You don't participate, no one's forcing you to participate, but the ethics of making sure people are aware that they exist. And that if you'd like to participate, that is your choice.
Have a good day at work.
I can hear somebody talking. I thought, oh gosh, we've got somebody on that doesn't want me to say. But so that's kind of the big deal right now. And I guess I would say to the people that might be concerned about the vaccine, to produce vaccine and medicine, the reason why it takes so much time often is because of money. And right now, money is not an option. Money is on the table. So I think that sometimes don't be afraid of how fast things are moving, because oftentimes people will start to develop something and stop only because of money, because these are private companies investing and they're kind of figuring out whether or not they're going to make money. So we've got, that's the hard capitalism of, medicine. But right now, we as the people, we are funding a lot of these trials to move them along faster. But I've been assured, and I'm hopeful everyone on this panel, Dr. Fauci, they are not cutting corners in terms of what it takes to move through the scientific rigor. It's just, you can move a lot faster when money's not when money's not an option. I hope that makes sense.
Yes, and it is reassuring, I think, as well. And you mentioned, Sam, the capitalism surrounding the disease, and I'm really struck on 236. There's a really powerful scene in which we learn that by this time, no public place or building had escaped conversion into a hospital or quarantine camp, with the exception of the prefect's offices, of course. And then a little, and this is the one and only mention of how the sanitary workers are wearing masks of sterilized muslin. On the face of it, the disease should have extended because we know in this part of the novel that the plague has turned pneumonic, as Camus says. And this scene struck me, relative to our conversation about disparities and then Sam's mention of capitalization. Meanwhile, the authorities had another cause for anxiety in the difficulty of maintaining the food supply. Profiteers were taking a hand in purveying at enormous prices essential foodstuffs not available in the shops. The result was that poor families were in great straits while the rich went short of practically nothing. And I think this is, one of those commonalities we find in many, many pandemics. And this also, by the way, brings to bear the colonial situation, because when Algeria was colonized in 1830s, the Pied Noir population moved out the Algerian from the productive farmlands where they had been doing their own subsistence economy and turned a lot of this into wine production regions. And, we might want a glass of wine during a pandemic, but you can't survive on wine alone. And so this is one of those trap doors that our colleague, Dr. Berglund, talked about. Like, if you lift open this trap door and you go in, you see that there's a lot of, the inequity with the foodstuffs coming in has so much to do with not just class, but with colonization in this case. So, we're just about ready to close up our discussion with the panel, and I just want to invite each of them to see if they have other parts of the novel they'd like to close with, other thoughts they'd like to leave us with. So let's see. I guess I'll let you volunteer instead of calling on you. So how?
So one of the things that struck me was the change in the way they dealt with the dead. and kind of the illusions that they had, you know, where corpses would be put into coffins, but then the coffins reused. And then they started sending ambulances at night to these mass graves to handle all the bodies, and eventually had to cremate the bodies. So there's just this steady, you know, it just becomes, how do you deal with the volume, not honoring the life, right? And that the rituals, our normal rituals around death, were disrupted in the novel. The rituals that allow people to grieve, that allow people to honor their dead, were disrupted, and that's what we've seen with COVID-19. And you know, I won't go into stories because it'll be too upsetting, but these are real people, these are real lives, and the ripple effects on families and communities is profound.
Yeah. Thank you for that. Thank you. What else?
Please wear your masks. Encourage others to do it, not in a fight, but in a positive and loving and communal way. That's it. Thanks.
Thanks, Mayor. We do see Father Panaloo before he gives his first sermon. You may remember a detail that we learned that he has been giving a series of lectures on individualism before he gives that first sermon, which I think is really interesting because he definitely changes his tune the second time around in his sermon. So, yeah.
I think if, you know, the question was asked, what would you like to see continue, or what do you think will continue? And I think for me, it's humanizing this whole situation and being, you know, having empathy for others, because there's no substitute for that. That is the thing that will get us through this.
Yeah. Yeah. Thank you for that, Linda. And empathy becomes huge in the novel too. And I think throughout the pandemics that we've touched on in the course of our study together, we see that this is something that is important to cultivate. Yeah. Anything else?
Maybe just, you know, sticking with that spirit of, you know, I think about the decency of work, you know, and just doing your job and knowing that all of us have a place to play a part in this, and we can do it in small ways and big ways. Some of us are in health, some of us are in medicine, some of us are in art and history, and all of us, everyone on this group, you know, we all have community, and we all are responsible to that community. We have families, and we can all figure out a way to contribute to making something beautiful out of such a dark place. And it doesn't have to be from health, you know, it can be, everything is health. We'll claim everything. We'll say art is health, you know. But it's, everything makes people feel better, and we all have that power to do that.
That's so great. I'm glad you said that, Sam. And it really comes back to Lucas's question at the very outset. What if we're not in public health? What can we do? And I think you just addressed that. So you are amazing. I'm reading lots of love in the chat. This has been an amazing conversation. Thank you so much. Really eye-opening. Thank you for your time. And, you know, we all know that you didn't have a bunch of extra time, and that's why you volunteered to join the panel. We know how busy you are. And I share the sentiment with folks in the chat. Thank you for your insight, sharing your knowledge. Thank you for keeping us healthy, for keeping us thinking. You're welcome to stick around, but we're going to take a 10-minute break and then go into our distinct breakout sessions. So thank you. Thanks a million. Appreciate you all.
Thank you.
Yeah, thank you very much.
Yeah.
Yes, thank you.
Bye.
So we'll call this this second panel a success, and thank you very much to our community audience. Thank you to Zach for keeping us on Facebook Live and for helping moderate. So good night to our community as well, And thanks for joining us. Next Monday, we have another event, a storytelling workshop. We hope you can join us for that. We're going to be talking about what stories mean to our cultures, our lives, and different professions. So let's, class, take, what do you think, fellow professors? 5 minutes? 8 minutes?
8 seems good.
All right.
8. All right.
8
Excellent.
minutes. So everyone reconvene please in their sections at 7:20. All right. So thank you for joining us. And then for Hume 382, be prepared to share some of your interview questions. That's what we're going to do in our breakout session. So I'll see you at 7:20.
Awesome.
Bye, Danelle.
Thanks, Dr. Woods. Bye, bye, Dr. Rui. See you in a little bit. I put my breakout session on the chat if you need it again.
Awesome.
Thanks.
All right, folks, welcome back. I hope you had a nice break. I just want to spend a few minutes on your reactions with our panel. Do you think it was useful? Do you think it was interesting? What do you think was helpful about it? What would you like to know more? Genevieve.
Oh, I would like to see a lot more. Well, I would have liked to hear some harder information that they might be privy to that's not being told to the public. Of course, I can see why they wouldn't tell us, knowing that it's a live Facebook feed. So that would be bad. But I was kind of hoping for like maybe a little insider information about the vaccine or anything, if they've been being told, or if the CDC is getting any like stronger presence, at least in the States, so they might be able to maybe go above some governors who aren't using proper practices.
Yeah.
That's about it.
Yeah. No, I hear you. I hear you. It's always nice to have inside information. I think from Dr. Sabo, we got some good insider information. Particularly what was revelatory to me was, you know, the fact that when there's a lot of money behind vaccine development, it can happen quickly. But also troubling was to learn that right now there's this, you know, it's being tested on 80% of the test population is white. And we know that vaccines work differently on different ethnic populations. So it sounds like they're going to do a push towards that. Yeah. Yeah. So good. Yeah, we rarely get to hear from experts. Megan's right. And it was so great to hear from the other side. I think someone said it really well in our discussion that, you know, we're, you know, those of us who aren't in the health professions are coming at it as potential victims or our loved ones or things like that. But to hear it from the health expert side is really useful. Yeah. What else? Your impressions? Yeah, Kiana says I feel like I could trust what they're saying. Yeah, I mean this is what they've studied and done for years, of course. So it was really interesting to hear their stories for sure. And you know, Jordan brings up a good point. You know, how is the election going to play into safety protocols going forward? You know, Camus' novel makes this really clear. The discussion we just had makes it really clear. It's all patently clear to you all out there that this disease has been politicized like no other, except, as Mayor pointed out, perhaps AIDS in the 80s and 90s. So it is really, really interesting. Yeah. Anything else? Your reactions? I'm glad we could do that. That was great. In a few minutes, I want to hear from you about what kinds of interview questions you've come up with. But first, I want to just review quickly with you Elizabeth Colbert's article. I asked you to read that for tonight. And I just have a few points I'd like to bring up from the article. But first, I want to ask you if you have any questions or any like lightning bolts or any observations to make about Colbert's argument. Anything you thought was worth mentioning? What is her argument, you think?
Wait, could you repeat the question? Sorry.
Sure, Kayla, no problem. What do you think Colbert's argument is in her article, Pandemics and the Shape of Human History? I'll go over a few of the highlighted points. Yeah, it was cool seeing the origin of the name quarantine, 40, which means 40 in Italian, right? And so ships that were coming into Venice had to dock for 40 days in order to be rid of the infection, not because they understood how the infection was transmitted, but because that took the time to clear out, you know, people who would be dying and clear out the rats and things like that. 40. So Colbert, who's a science journalist, she works mostly on climate crisis research. She says, just at the outset, just as there are many ways for microbes to infect a body, there are many ways for epidemics to affect the body politic. So I think that's the most important takeaway, I think, from her article, and we see that certainly today. She talks about one of the earliest plagues, the Justinian Plague, and this is in the 500s in Constantinople. The emperor paid for the bodies of the abandoned and the destitute to be buried. Even so, it was impossible to keep up. The death toll was too high. And Colbert kind of rehearses how Justinian's reign sort of came crashing down. Even though he survived the plague, physically, his reign suffered from it. Yeah, Danette, I agree. Danette says, I thought it was interesting that Colbert mentioned the correlation between pandemic and war and colonization. Yeah, let's definitely look at that. A couple more points before we get there, if you'll bear with me. Colbert goes on to say that the plague hit the powerless and the powerful alike. And this certainly reverberated with me because of the news that President Trump has contracted COVID, and I'm sure we know that it hits the powerless and the powerful alike. And then Colbert gets into her sort of argument about the microbe being a real agent in history. So if we think about a microbe having agency, the power to affect history, she makes the case that clearly it does. History is written not only by men, but also by microbes. And then we get into the part that Danette brought up. There are many ways for epidemics to play out in body politics. They partner with war. Sometimes the pairing favors the aggressor, sometimes the aggressed. So we know that, she goes on to talk about the virgin soil epidemic over on page 3. The first New World pandemic began toward the end of 1518. And what is this virgin soil epidemic that occurs during the Columbian Exchange? What is this? What is the virgin soil epidemic? Yeah, Danette, the spread of smallpox. Absolutely, exactly. Right, it is impossible to say how many people died in the first New World pandemic because records are sketchy, and Europeans also brought with them so many other virgin soil diseases, including measles, typhoid, and diphtheria, and probably killed tens of millions of people. And so it wasn't just a colonization effort, but a demographic disaster, a historian calls it. So sometimes microbes favor the aggressed, sometimes they favor the aggressor. And also, as Dr. Sabo and others mentioned in our panel, public health measures run up against religion and tradition. They did then and they do now. So the description I thought Dr. Sabo gave of public health, how it's chronically underfunded, how public health experts are in the business of limiting your civil rights in a way to keep you healthy, and they're really mindful of this. It's a tricky, tricky business to be in. Colbert tells us something really interesting. Towards the later centuries of the bubonic plague in the 18th century, particularly in Marseille and around southern France, we see that the lazaretto, the quarantining isolation wards were being set up at this time, but people wouldn't announce their family cases often because they didn't want to suffer from exile and being separated from their loved ones, which is really interesting. Those charged with enforcing the rules often had little interest in protecting the public. And then Colbert kind of closes by talking about cholera, which is a major global pandemic still ongoing that we haven't really covered in this class. And the cholera epidemic, of course, intersects with the major earthquake in October of 2010 in Haiti. So she closes by saying epidemics are by their very nature divisive. The neighbor you might in better times turn to for help becomes a possible source of infection. So I think this is a really interesting point. What is common across all pandemics, does she say? What do all pandemics have in common? She kind of closes with this idea. It's that second to last paragraph. She says, the trouble is that for all the common patterns that emerge, there are at least as many confounding variations. During the cholera riots, people blamed not outsiders, but insiders. It was doctors and government officials who were targeted. Smallpox helped the Spanish conquer the Aztec and Incan empires, but other diseases helped defeat colonial powers. During the Haitian Revolution, for example, Napoleon tried to retake the French colony in 1802 with some 50,000 men. So many of his soldiers died from yellow fever that he gave up the attempt and decided to sell the Louisiana Territory to the Americans. So I love this article because it really points to this notion that, you know, history is made up of more than human action. I mean, the microbe itself is a historical actor. So I find that to be really interesting. Anything else about Colbert? All right. So what I would like to do now is I'm going to ask you to get into breakout groups just for 5 or 6 minutes. Yeah, it is interesting, Patrick, to see that Napoleon was defeated by disease, certainly. And this is not the first or last time that we find this to be the case. All right, so I'm going to ask you to get out into breakout groups, and I'm going to ask you in your breakout groups to share with one another some potential interview questions you have for your interview subjects. And then as a group, I want you to pick 2 or 3 of the best ones you've heard from your group members and come back to report to all of us. So just something, just kind of mellow, share your possible interview questions, pick 2 or 3 of the best ones you've heard, come back to report, okay? So what do you think? I'll give you 8 minutes and I'll call you back in at 7:40, if that's all right. And also, by the way, if you don't have a subject to interview, you may be interested in interviewing someone on our panel for today. Just saying. All right, I'm going to create your rooms now, and I'll call you back in at 7:40.